This program is brought to you by the Vegetarian Society of Hawaii, a nonprofit organization dedicated to sharing with the community the many benefits of a vegetarian diet. Free monthly meetings include vegetarian experts found locally and on the mainland, quick and easy cooking demonstrations, and healthful and delicious food samples. Members enjoy an informative quarterly newsletter, social activities, and discounts at many vegetarian-friendly restaurants and health food stores. For an application, call 944-8344. That's 944-8344. Or visit our website at www.vsh.org. vsh.org.
Welcome everyone to the monthly public lecture sponsored by the Vegetarian Society of Hawaii. We thank you all for coming. The Vegetarian Society is a not-for-profit volunteer organization founded in 1990 for the purpose of promoting human health, animal rights, and protection of the environment by means of vegetarian education. It's the largest regional vegetarian society in the country with more than 1,800 members. Tonight we have a surprise. In addition to our announced speaker, we have a special feature, a short. We have a videotape, a 4-minute speech that is very difficult to hear, so we're hoping everyone will be very quiet and listen very hard. I think we can just barely make it. This speech is given by Rad Fournier. Rad, are you here? So you want to just stand up? Rad is an 8th grader at Punahou. And Rad has the unique, almost unique distinction of being the gold medal winner of this year's Damon speech contest. And guess what he spoke on? Vegetarianism. So we're just so proud of him. Isn't that great? Rad is over there sitting with his grandmother, Lynn Ware. They're members of the Vegetarian Society, and Lynn is vegan, a lifelong vegan, I believe, and Rad and his mother and his sister are also lifelong vegans, so it's really quite wonderful. What we're going to do is show the 4-minute speech itself, listening very hard, and then Rad will come up and answer just a couple of questions if anyone has any, before I introduce our main speaker for tonight.
Our next speaker is Rad Fournier. Rad will speak about vegetarianism.
Good morning, everyone. I have a question for you. What comes to your mind when you think of a vegetarian? A small, skinny, carrot-gnawing, fruit-slurping weirdo? Kind of like me? Well, think again. What do horses, rhinos, elephants, and gorillas have in common? They're all walking powerhouses. And, you guessed it, they're vegetarians. The fact is, human bodies are much more like plant eaters or herbivores than carnivores. Carnivores have claws and sharp, pointed front teeth. Plant eaters and humans don't. Carnivores have intestinal tracts that are 1/3 the length of herbivores and humans, allowing them to get all of that decomposing meat out of their bodies quickly. In us, it sits and rots and releases toxins. Which brings me to the health benefits of being a vegetarian. According to the American Medical Association, 90 to 97% of heart disease would be prevented by a vegetarian diet. Our bodies just can't handle all of that animal fat and cholesterol, so plaque builds up in our arteries and causes heart attacks and strokes. Studies also link cancer to meat eating, kidney disease too. Kidneys rid our body of toxins, but so much meat in the diet overworks them, and they fail. Speaking of toxins, these animals we eat are full of tranquilizers, antibiotics, hormones, and 2,700 other chemicals and drugs. There's sodium nitrate that is used to make the meat look nice and red, instead of the unappetizing, scabby, gray-brown color of a dead body. There's diethylstilbestrol, a growth hormone that for health reasons has been banned in 32 countries. Also, the meat industry is infamous for not enforcing proper health standards. Carcasses are often contaminated with cockroaches, rat stool, and rust. Yeah, but what about protein, people always say. According to the American Medical Association, all the protein we need is in grains, beans, nuts, and vegetables. And in fact, Too much protein is far more often the problem than not enough. Yale University studies show that too much protein, quote, reduces the body's energy and its ability to recover from fatigue, unquote. Now here's an economic consideration. Listen to these figures. Over 90% of all grain produced in America goes to feeding livestock. For every 16 pounds of grain that is fed to cattle, we only get 1 pound of meat back. We actually produce enough food for everyone on the planet, but we feed it to the animals, and then we eat them. Then, of course, there's the ethical considerations, that being a vegetarian is just a more humane way of life. Some might say, well, you vegetarians, you rip apart the head of the cauliflower, and you cut out the heart of the artichoke, and with your teeth, you tear into the tender flesh of the helpless fruit, and you crush open the poor defenseless nut for its meat. Come on, most of us would have to admit there is a difference. Russian author Leo Tolstoy believed that by killing animals, man suppresses in himself sympathy and pity towards living creatures, and by violating his own feelings, becomes cruel. Great men throughout the ages were vegetarians. The mathematician Pythagoras, the famous playwright George Bernard Shaw, Benjamin Franklin, Leonardo da Vinci, to name just a few. Well, that's all that time allows, but I hope I've left you with a little food for thought, with a few meaty ideas that you can really sink your teeth into. Yes?
What's your favorite dessert?
Dessert? Well, most cakes have eggs, but the cakes that my mom makes, those are good. Chocolate cake with strawberries and whipped cream and blueberries. Ah, I'm getting hungry. Yes? Have you ever eaten meat? Nope, I've never eaten meat in my life. Yes? Yep, I was raised a vegetarian right from when I was born. Both of my parents were vegetarians. Well, how about I tell you other things about my speech? The main reason I actually originally wanted to do it was because people would always have all these questions for me. And so I thought, heck, I might as well answer them all with a speech. And so when I gave the speech, a lot of the questions were answered. And in fact, a lot of my friends and other kids in the school, they would come up to me and tell me, oh, Rad, I've decided to try vegetarianism for a couple weeks or something. And that always made me happy. At least I did something. And one girl actually just recently came up to me and told me that she was a vegetarian because of my speech.
Thanks, Rad. We're so proud of you. So that there is hope for the future. It's now time for our special guest. We're delighted to have with us tonight Dr. Kerrie Saunders, a nationally known presenter and author whose work is featured in numerous magazines, newspapers, and e-zines, and on the radio. Her popular advice column, Dear Dr. Kerrie, is featured in the widely read lifestyle magazine VegNews. Dr. Saunders is also the food and fitness consultant for the McIntyre Health Center for Integrated Medicine in Port Huron, Michigan, where she teaches clinic patients and professionals how to use controllable lifestyle factors to help prevent or reverse food cravings and addictions, obesity, and chronic disease processes such as arthritis, cancer, diabetes, osteoporosis, and cardiovascular disease. Dr. Saunders' clients include government agencies, school systems, hospitals, and corporations. She began her career in 1987 as a master's-level psychologist. She earned her doctoral degree in natural health after postgraduate coursework at the University of Michigan, Miami University, and Clayton College. Her current projects include the improvement of school nutritional lunch programs and development of the casmorphin addiction theory. She's a certified prevention consultant and certified addictions counselor. Her latest physician-patient resource book, The Vegan Diet as Chronic Disease Prevention, is available here tonight, and I'm sure she would be happy to autograph a copy for you after her presentation. Please welcome Dr. Kerrie Saunders.
Okay, well, after Rad, I can just pack up and go home now. Thank you so much. That was very inspiring to see the youth. That was wonderful. Dr. Harris, one of my longtime heroes, asked me to kind of stay where the camera is, and I said, you have no idea what you're asking somebody who gesticulates and walks all over the stage, so I'll do my very best. Thank you also to Dr. Steph for allowing us, my family, my daughter and my husband, to stay with him for a few days while we're here. And thank you for the organization for coordinating this whole thing. What I'd like to do is give you an idea of what we'll be talking about in the presentation. We'll give a quick overview of the connection between diet and disease processes. We'll look specifically at obesity, diabetes, atherosclerosis, and osteoporosis. We will summarize with the new 4 food groups of the Physicians Committee for Responsible Medicine, and end with tips on how to improve your general overall health status. Before I begin those big 4, I want you to realize that proper nutrition can affect many different disease processes, not just the 4 you'll hear about tonight. If you think about it, food is chemistry. Even water, H2O, it's nothing more than hydrogen and oxygen. So everything that we eat will alter the chemistry of the body. That's the basis I want you all to take home with as your take-home message. Cancer, ear infections, the first thing we do with ear infections at our center is remove all dairy products. And I can talk about that in the Q&A if you're interested in more. Arthritis, gout, the most common triggers for gout are actually seafood, but there are some other triggers for other individuals that might be more individual. For example, coffee, oatmeal can be a trigger for gout. Anything at all that would be gastrointestinal, candida. We're even seeing some process with multiple sclerosis. When we start getting tingling and numbness and some nerve damage, the first thing we do at our clinic from a nutritional standpoint is remove aspartame, NutraSweet, Equal, esters of wood alcohol, these artificial sweeteners, because we are seeing so much damage related to overuse of those synthetic sweeteners. Of course, acid reflux, asthma, angina, fibrocystic breast. In other words, with this, what we're doing is removing dairy. Hypoglycemia, kind of the reverse of diabetes, still the same problem. We have an imbalance of insulin and blood sugar, which I'll talk about at the end. She did a great job with my background. I won't reinvent the wheel. At our Integrated Medicine Center, we do traditional medicine. We have an MD on staff who is also a cancer survivor. She's trained in Eastern and Western medicine, so she's truly a gift. We have a medical hypnotherapist who can help teach people to relax, to maybe reduce the amount of pain medication that they need to take, or help prepare them for a surgical procedure. The acupuncturist is actually our MD. We have a massage therapy team, and my position there is the food and fitness consultant. So I work with people who come to the clinic who want to wean off of medication with our MD as they wean on to better nutrition. Why do I like preventive medicine? Because it raises the bar. It says if we set the total cholesterol goal at 200, which is what the government essentially has done, 200, we get about 50% of our people dying from heart disease or stroke. Preventive medicine says, what goal can we set total cholesterol at so that we're not seeing heart attacks and strokes at that rate? And that rate, for example, would be 150. We're looking for a total cholesterol rate of 150 or perhaps 100 plus your age. That's our goal at our clinic. So preventive medicine raises the bar and says we need to set better standards for individuals. Here's one of my favorite myths, that we are living so much longer as Americans. But really, if you look at a 100-year time span, we've really only added on 6 years to the end of life if we take out that subset of humans that have died as infants. We are doing much better keeping premature infants alive and so on. But when it comes to taking that group and looking at how much we've added, it's about 6 years. And this is despite MRIs, PET scans, sterilization techniques, vaccines, antibiotics, and so on. So we've added a whole bunch of technology to medicine, but we still see incredible disease rates, and we've really only added 6 years. So something's wrong with the picture. So the nutritional medicine community is looking at what is the role of food with disease. What have we done differently in the last 100 or 200 years? We've been gradually increasing the amount of fat, sugar, animal proteins, and junk in the diet. We all know that. And at the same time, we're decreasing the amount of plant foods that we're eating. Whole grains, nuts, seeds, vegetables, fruits, beans, peas, lentils. We've decreased that while we've increased these other foods. And you're all familiar with these goofy changes we've done. When we refine a product, that means we're basically stripping out the fiber. So when you look at a package of bread, for example, and it says enriched, please think stripped. Enriched means they've stripped out about 97% of the fiber or so, at least 40 to 50 different nutrients. They've maybe sprayed on 5 to 7, and they call that enriched. So please think of the word enriched, translate in your mind, and think stripped. This is a stripped product. No sense wasting money on it. Hydrogenization we'll talk about near the end. That's the trans fat process, taking a plant oil that should be liquid and making it into a solid. The artificial colors, sweeteners, flavors, and so on. The bleaching process that's done with sugar beets, chemical preservatives, and so on. Regardless of the disease process we look at, we are eating too many saturated and trans fats, too much animal protein, too much cholesterol, too many chemical additives, and refined processed junk. My favorite description of that is the crinkly packages. Anything that's a crinkly package or a box, these are refined packaged junk foods. Certainly not enough phytonutrients. The phytonutrients are a very special group of chemicals and compounds that we need that only come from plants. Phyto means plant. So these are not vitamins, they're not minerals, it's a whole new subgroup. For example, lutein, you've heard a lot about that, lycopene in tomatoes, zeaxanthine, the sulforaphanes. These are nutrients only ever found in plants. Antioxidants, easy way to remember, your cancer fighters, ACE, vitamins A, C, E, and the mineral selenium. Mainly found in plants. Fiber, only ever found in plants. Are you seeing the pattern? We need to increase our plant foods. Drinking water, it's kind of fun for us at the clinic when we say you really need to drink more fluids, but we're not talking about pop. People say, what else is there to drink? My goodness. Essential fatty acids, which we'll talk about near the end. So let's start with obesity. Basically, 1 out of every 3 Americans right now would meet the criteria for clinical obesity. We're spending about $30 billion every year on quick fixes. My favorite example is QVC, or the Home Shopping Network. When we're talking about exercise equipment, we talk about how wonderful and fun it is, but they always spend the most amount of time on how wonderfully it stores. Why are we thinking about storing it? Because, again, it's a quick fix. We haven't changed the mindset to say we really need to change our lifestyle. We have to come in a new direction, the way we look at life. Many soft signs related to excess body weight, down at the bottom there. We know, of course, heart disease is related, varicose veins, diabetes, high blood pressure. But there are some soft signs related. For example, just less activity. Maybe you're not playing with your grandkids as much as you were 5 years ago, or you need to sit down more, or you're just tired all the time. Decreased immunity, getting everything that comes our way, snoring, excess sweat. These are all what we would call kind of soft signs of carrying around too much weight. They creep up very slowly. 95% of our dieters we know go on diet after diet. And the unfortunate thing is you usually gain that weight back with a vengeance. A few more pounds added on to the beginning base weight. We even have people now changing our anatomy. So they'll do the intestinal bypass or the stomach stapling. These are very, very drastic procedures that we can have reactions to medications, to anesthesia. We can have infection reactions. There are people that have the stomach stapled and then they actually burst the staples. You can die from this type of complication. With this slide, I just want to point out one highlight. They actually studied the elementary school children in Bogalusa, Louisiana. So in other words, these are 8, 9, 10, 11-year-old children. Their total cholesterol averaged 300. Okay, now the problem is, I'm sure it's not different in any other public school in the country, because what are we feeding them at the lunch? The McDonald's and the pizzas and the fried chicken nuggets, whatever a nugget is, French fries. If you look at what we're feeding them in the schools, and probably what they're eating at home as well, it really doesn't surprise us. But it's kind of criminal if you think about it. A school is where we should be teaching the standards. Another thing that you need to realize when we're talking about fats in the diet is there are what we call big fat lies. And I noticed you had Brenda Davis a couple years back, and she probably highlighted this. When an advertiser says this is a 2% milk, many of us would think that means 2% calories from fat. But the problem is they're measuring the volume, so they're measuring by weight, which includes the water weight. But remember, water has no calories in it. So we could drink a gallon of water, and if we were hungry to begin with, we're still going to be hungry when we're done with the water. Our body is looking for caloric energy. So if we look at milk from a caloric standpoint, it's 35% calories from fat. Just a little note before we go too far, the Physicians Committee for Responsible Medicine recommends closer to 15% calories from fat. So 2% milk is twice the fat we're looking for in an average food. In my book, I talk about the different explanations that I see for obesity. Remember, I kind of came at this from a psychological standpoint too. The first one up at the top is the brain chemistry might be insensitive to leptin. Leptin is the chemical in the brain that says, I'm satisfied, I'm done, I can push away from the table, I can walk away. If your brain is insensitive to leptin, you literally never feel full. You feel hungry all the time. It's almost like a shark. Very small percentage of the population has leptin insensitivity, but it is an explanation. The second one down is we're storing too much fat. The body, for example, in postmenopause, when we have maybe too much estrogen, estrogen tells the body to make more fat, fat tells the body to make more estrogen. So we end up with a cycle that can occur in postmenopause. Underneath that, depressive brain chemistry. This can be a genetic situation, a genetic depression. For example, you're just born with maybe not enough serotonin or whatever. Or it can be a situational depression. My husband died, my child went off to college. There might be a situation that is truly depressing. And what the body normally does is look for stimulant foods that really will, for a short period of time, stimulate your brain chemistry. Caffeine, chocolate, sugar, Mountain Dew. You can see the pattern here. We're looking for stimulant foods, and they literally work at a brain chemistry level. But it's a short term with a crash at the end, which starts this cycle. Up at the top, eating too many calories for activity level. For example, we sleep in a comfortable bed, we sit in a car, we stand on the elevator, we sit at the drive-thru. We are literally not moving enough. The next one down is actually my favorite because I deal with this one in the office the most. Poor family dietary habits. If I had $1 for every time someone came in and said, high cholesterol runs in my genetics, everybody has it, I'd probably be very wealthy. What we're really looking at, because you'll see later, high cholesterol is not really genetic for most people, is poor family dietary habits. Grandma smothered everything in butter, mother smothered everything in butter, so the daughter smothers everything in butter. So you can see we pass these family dietary habits down. The very last one, when we're eating too much fat and cholesterol and not enough unrefined carbs, so vegetables, beans, peas, lentils, fruits, and so on, we literally deplete the serotonin in the brain. I noticed you also had Doug Lyle, who's another psychologist kind of cross-trained in diet. He talked a lot about dopamine and the pleasure-seeking cycle. Serotonin is another brain chemical that you need to know about, though, because if your serotonin is low, you'll feel kind of depressed, which swings you over to looking for stimulant foods. And here can be a lot of extra calories. Is anyone here a fan of the high-protein diets? Okay, great. I'm just going to highlight a couple little things. Barry, Sears, and Atkins, Sears is from the Zone diet, of course the Atkins diet, are doubling and tripling the amount of protein that a human should probably be eating. And I'll give you some examples of that. The World Health Organization, which is a group that looks at diet and what would be optimal for humans, recommends closer to 10 to 15% calories from protein. Human breast milk, in other words, this is the perfectly designed food for a human to double and triple its size during infancy, is really only about 8% calories from protein. The American College of Preventive Medicine and the Physicians Committee for Responsible Medicine, about 10 to 15, maybe 20% at the very most if you're an athlete. But looking at Sears and Atkins, they're doubling and tripling. So what would be wrong with too much protein? First of all, osteoporosis, which we'll cover a little bit later, but kidney and liver disease, constipation from not enough fiber, terribly smelling breath and sweat, malnutrition, and here's the kicker, metabolic reset. When your body is not getting enough plant foods, the sense is that there must be a famine or a drought in the environment. The plants are not growing, so the body starts to reset its metabolism to store more fat. So at our clinic, if Dr. McIntyre walks by me and says, "I'm sending you Joe, he's post-Atkins," that's kind of a diagnosis where I work. That tells me that I need to now feed this person foods that are gentle on the kidneys and liver, so we're going to switch out of animal proteins and look for beans, peas, and lentils, for an example. It also means that they need to lose weight because they've got excess body fat. I've got to feed them foods that will help remineralize their bones. So we look at post-Atkins as kind of a diagnosis where I work. One last slide about the high-protein gang. Kwashiorkor. How many of us know people with kwashiorkor in the United States? It's virtually unknown because it's a disease of eating not enough protein. But how many people do we know as Americans that have osteoporosis, arthritis, and kidney disease? We all know somebody with one of those. And if you think about where the excess meat protein is packaged, it also has the saturated fat and cholesterol. So now we also have to ask ourselves, who else do we know that has heart disease, cancer, stroke, diabetes, or obesity? Now we're talking about the American population. So we didn't even start with low protein. We started with high protein and maybe even made it worse. Let's look at the different food groups. These are the Physicians Committee for Responsible Medicine at the top. They're looking for 10 to 15% of your calories from fat and protein, and the bulk of your diet from carbs. This is not the refined carbs, the donuts, cakes, cookies, and pop. These carbs are beans, peas, lentils, vegetables, and fruits. So let's look at the different food groups and how they stack up. Fruits, vegetables, whole grains, and legumes would make a perfectly well-rounded diet with maybe a handful or two of nuts and seeds a day. We would end up with numbers that look beautifully. However, if we look at some of the other food groups and compare them to the Physicians Committee, we realize these should either be side dishes or maybe broths, if they are included at all. And there are many people in the room that never include these foods in your diet, so you can certainly get plugged in and get some ideas if you'd like to go vegan. Cow flesh would basically be like filet mignon and hamburger and steak. Bird and pig would be chicken, turkey, ham, pork, fish, cheese, eggs, and milk. And you might say, well, but Kerrie, milk has some of those carbs. But you know what? It's not with fiber. And lactose is that simple sugar. It's not the kind of carb we're looking for that we would find in beans, peas, lentils, or vegetables. It's a sugar carb. Okay, Dr. Dean Ornish, when he was talking about high-protein diets and the Atkins diet specifically, he said, you can lose weight in lots of ways that are not healthy. Taking chemotherapy, getting AIDS, cancer, being an alcoholic, you will lose weight. But even if you lose that weight, you're mortgaging your health in the process. And if you're not familiar with Dean Ornish, I'll just fill you in very quickly. He was really a pioneering mainstream physician. He went into the arteries with the scope, took pictures of the gunk on the inside of the arteries, which we'll talk about later. He then took the scope out, changed their diet, put the scope back in and proved that these arteries are now cleaned by changing the diet. So Dean Ornish is really a pioneering physician using mainstream technology to prove the power of food as chemistry. The truth about those unrefined carbs, they make us feel satisfied, they're fiber intact, they're lower in calories than fat. There are a few high-fat plant foods that you need to know about if you know someone who's pregnant, nursing, an athlete, a child, perhaps somebody who has been suffering from gluten intolerance and they really do need to gain weight. Here are some wonderful sources of high-fat plant foods. Nuts, seeds, avocados, and coconuts. Olives are 96% calories from fat. And tofu. The reason that's here is, yes, it's a processed food, and I want you to realize that not everybody has to be eating tofu to be vegetarian, and it's certainly not a weight loss food. It's okay to add in, but realize it's not a weight loss food. The processed oils you're going to want to stay away from. Processed, you'll see later on when we talk about trans fats, they're not healthy. Let's switch gears a little bit and talk about diabetes. 7 million in the United States, the number is growing all the time. 10% are on insulin. The only good news about that is that 90% are not yet on insulin. So those 90% are the ones we want to target very aggressively. Even the 10% that are on insulin, if they're working with a competent nutritional medicine physician, they can actually sometimes reduce the dose that's required by changing the food chemistry, which if you're thinking about a child with type 1 diabetes, you really want to give them some room to grow with that prescription if they need it. You don't want to start them out on high doses just to try to compensate for a poor diet. We want to give them some room to breathe. Here's an interesting side note. With our type 2 diabetics, 90% are also clinically obese. So we know that fat's a part of that. Complications, blindness, kidney failure, stroke, atherosclerosis, heart attacks, limb amputation still occurs even with our diabetics on glucophage and some of these other type 2 meds. You can also get too much and then all of a sudden now we're into hypoglycemia and insulin shock. When I'm speaking with physicians, they always want to climb all over me about using a 1927 study, but there's a reason that I'm using this study for you. I'm trying to show you that what I'm about to say is not new information at all. It's just information that we don't hear a lot about. Dr. Sweeney took young, healthy medical students. This is how they made money back in the day. They would sign up for a study and do whatever it took, and they would make some spending money. What he did was alter the diet, 2 days on a very high-fat diet, 2 days on a very high-sugar, simple carb-type diet. And what he was measuring was blood glucose. On the 2 days of a high-fat diet, every single medical student spiked into the diabetic range. So there's some kind of link there. 2 days on a high-sugar, simple carb diet, they had some fluctuation, but not one student spiked into the diabetic range. So back in 1927, Dr. Sweeney concluded maybe we should be looking at the fats and oils interfering with insulin instead of the sugars. Yes, sugar can be a problem in excess, but when we're looking at the basic foundation of changing a diabetic's diet, let's look at fats and oils first. Let me give you an example. If you remember the Exxon Valdez oil spill, watching those birds trying to swim along the top of the water in an oil slick, they couldn't get where they wanted to go because they were trying to work in an oil slick. Same kind of thing with the insulin in your bloodstream. It's trying so hard to get where it wants to go, but it's trying to work around all these fat and oil molecules. Another way to look at it, at least 85% of our diabetics have twice the normal insulin levels. So what does that mean? It means the brain realizes the insulin is not getting into the cell to unlock it. There's a problem, so it starts pumping out even more insulin. So the bottom line is it's not the pancreas that's malfunctioning. It's the insulin itself that can't get in and do what it needs to do. So the brain says, make more insulin. Long term, though, we're going to end up with pancreatic damage because you can't keep overstressing your organs like that. And insulin and pills can control the blood sugar levels on your labs, but really long term we're still seeing complications. So it's better to change the diet first and optimize your nutrition. Just some food for thought. I'm borrowing a statement from Red here. 100% of the children with diabetes mellitus are also testing in the study positive for the cow milk antibody. In other words, they are also allergic to cow's milk. The theory here is that the antigen and antibody reaction is also attacking the child's pancreas, doing pancreatic damage. So perhaps we need to eliminate the dairy products right off the bat. It's so very rare to get 100% of anything in a scientific study. This one we all need to pay attention to and start looking more at it. Circulatory diseases. Before we go ahead, you need to realize that cholesterol is more like a wax, fat is more like a grease or an oil. So if you have a steak and you're trimming off the fat, you're eliminating some of the fat, but that cholesterol is still in the muscle of the meat. So we're not touching the cholesterol at all by trimming the fat. At our clinic, we look at atherogenesis. In other words, wherever you have a blockage, it's the circulatory system that needs to be fixed. Patient in room 1 might have a blockage in the brain. Room 2 might be a blockage in the heart. Room 3 might want Viagra. The point with us is we've got a circulatory disease process, and we need to look at that whole system to fix it. High blood pressure is related too. When you get your total cholesterol from your physician, you'll have a number. Let's say it's 150, and we know that we're doing great. Underneath that total cholesterol, it's broken down into fractions. This could be intermediate, low density, ILDL, HDL, LDL, all these different fractions. The two that you hear the most about is HDL, high density lipoproteins, and LDL, low density lipoproteins. Easiest way to remember this is you want high and low. High HDL, low LDL, generally speaking. So if we reverse that and we've got your LDL creeping up high, we know we've got a problem. What are the most common culprits? Improper diet, poor stress management. Many of us don't realize how stress can affect our cholesterol levels. If you think about the fight or flight response, when we get under stress and we need to do something now, either run away or stand and fight, even back, when we were first designed, or however you want to look at it, in that fight or flight response, the body normally releases extra clotting factor. So if you're running past thorn bushes and you get a cut, you won't bleed to death. Or if you do get injured in a fight, you won't bleed to death. But look at our stresses today. We're in rush hour traffic releasing extra clotting factor. For what? We're thinking about the boss at work or problems at home or whatever, releasing extra clotting factor. We're doing ourselves harm. So I really need to look at how we manage our stress. That is a very real thing. It's not a cliche. Smoking, not exercising, and genetics. Remember when I said my favorite thing about cholesterol was when they say it's genetically high cholesterol? That's 5% of our population. The other 95% of the people that are on medication for high cholesterol, it's diet. We need to start looking at controllable lifestyle factors within our reach. If you've never learned about angioplasty, essentially what we're doing is sticking a tube into the artery that is clogged. I referred to this as gunk earlier. The gunk is cellular debris, metabolic waste as the body is going through its processes, cholesterol, saturated fat, trans fats, calcium deposits, and so on. So we stick this tube into this gunk, we blow up the balloon, pushing the gunk on the outside of the artery walls so we have a better diameter to go through, for the blood to go through. The problem, though, is patients can die on the table if we push that gunk and the artery bursts. 30% of our patients are going to have a reclosure of that very same blood vessel. And most people will end up with a closure in a vessel somewhere else in the body. So medicine needs to take the second step. They need to say, step 1, we've saved your life with angioplasty. Step 2, you need to know how to get the gunk out of your arteries before it happens again, immediately. So we really need to go that extra mile to do ethical medicine. Where is the cholesterol? This is my favorite error of Michigan physicians. I don't know how it is here, but they'll tell their post-stroke and post-heart attack patients to go from red meat to white meat. Okay? Let's look at where the cholesterol is in the diet. Number 2, there is not single white male. This is skinless white meat, okay? Cow is going to be your beef, your burger, your steaks, and so on. Chicken, it doesn't matter what cut. What we're looking at in portion size to compare this table is like a deck of cards size, that 3.5 ounce to 4 ounces of meat. If you look at that list, red meat and white meat are essentially exactly the same amount of cholesterol. You do save a little bit of saturated fat by going from red to white meat, but the bottom line is it's not going to help. We really need to drastically change and aggressively change our diet. Look all the way down, though. If you look at shrimp, super high in dietary cholesterol. There are so many what we call fish vegetarians or pesco-vegetarians, pesci-vegetarians. We need to realize we're still getting quite a cholesterol load with the seafood and the sea life. You're also getting the PCBs and heavy metals and lead and whatever else is soaking into the fat of that fish. If you look down also, dairy products, chicken eggs. I actually went to the American Egg Board to make sure that that was not a typo. 215 milligrams in one egg. Every single plant product, including nuts and seeds, 0 milligrams of cholesterol. Here's the kicker. There is no required daily allowance or recommended daily allowance, RDA, of cholesterol. The only reason that that will be on your nutrition labels is because physicians say you've had a heart attack, you've had a stroke, please watch your cholesterol levels. But it's not there because we have to get it in a food. Your liver makes 600 to 800 milligrams of its own cholesterol every day. If we look at cholesterol a little differently by people who choose to change the food chemistry, we see a really neat picture. Vegans are people who are only eating plant foods, whole grains, vegetables, fruits, nuts, seeds, beans, peas, and lentils. Lacto-ovo-vegetarians are eating plant foods plus milk and dairy products, which is lacto. Ovo would be the egg products, chicken eggs, caviar, and so on. The fish eaters, the pesco or pesci vegetarians, and then the non-vegetarians are the meat eaters or the standard American diet. So what Jack Norris, famous registered dietitian, did was he took 17 different studies, averaged out total cholesterol by dietary choice. The vegans were averaging a total cholesterol of 160. Remember, the goal was 150. What are the vegans doing that they can do better? Trans fats. Our packaged foods, our fried foods. Coke and fries are vegan. Doesn't mean it's healthy. So trans fats are where vegans can do better. Lacto-ovo-vegetarians, remember, they're getting the cholesterol from the eggs and from the dairy. 185 is their total cholesterol on average. 196 for fish eaters, and non-vegetarians are averaging 201. So remember, the goal here is 150 or less, or 100 plus your age. Before I leave cholesterol, you also need to know there's a related medical issue called C-reactive protein, which you will work with your physician on. That's a lab test, and they will work you through that. But you also need to know, as an informed consumer, where is the cholesterol in your diet. Just a little political statement I have to make. The American Heart Association, to this day, continues to serve chicken, beef, eggs, butter at its fundraisers and its meetings. You kind of have to look at it as job security. Okay, let's look quickly at changing the diet within a group of people. So we've eliminated the fact that maybe this group has better genetics than that group. We've eliminated that. We've taken the same group of people and manipulated the cholesterol that they eat. We start them on the general diet as a baseline. They're eating the standard American diet. Average total cholesterol, 220 to 35. Then we feed them 4 weeks on a zero cholesterol vegan diet, and their cholesterol drops down to 155, 160. Same group of people, we put them back onto the American diet, high cholesterol. Their cholesterol spikes up, 253, 260, 270. Same exact group of people. At this point, I'm thinking, what are they thinking? We changed their diet again down 6 weeks to a zero cholesterol diet. Their total cholesterol drops down again, 160. So what I want you to realize is all we're doing is changing the diet in this 4 to 6 week period, and we're impacting body chemistry that dramatically. It's astounding. Osteoporosis. Many people would say that osteoporosis is defined as a lack of calcium in the diet. But what we're looking at, medically speaking, with osteoporosis is a loss of your own calcium from your own bones into your urine. So you're literally urinating out the density of your bones. That is the medical definition of osteoporosis. The National Osteoporosis Foundation makes the following recommendations to prevent bone loss. Not smoking, making sure you are physically active, watching your alcohol, caffeine, and sodium intakes, making sure that you're not eating too much animal protein, and making sure that you are getting enough calcium. But what's the one category we never hear about in the media? Too much animal protein intake. We never hear about that as an osteoporosis risk factor. My suspicion is that so much of the American economy depends on high animal protein intake that they don't want to talk about that in the media. But the bottom line is, if we're going to be informed consumers, we need to look at the truth and then base our decisions on that, and maybe change the economy if we need to do that. What is calcium and where do we get it? It's stored in your teeth and your bones. We use it for heart regulation. It has to do with blood clotting, nerve transmission. So if Kerrie's saying, geez, I don't eat dairy or meat, where do I get my calcium? Green leafy vegetables is your number one source. In fact, Dr. Joel Furman, another specialist in nutritional medicine, says the base of that pyramid should be greens. Greens should be at the bottom. And this is where cows get their calcium, from eating greens. Broccoli, kale, collard greens, your whole grains, beans, peas, and lentils. Even some of the fortified orange juices, they're fortified with calcium. There are calcium-set tofus that you can buy. Any of the plant milks, soy, almond, veggie, and rice milk, just check the label. Many of them are also calcium-insured seaweed. But the bottom line, when they say building better bones, think beans and greens. These are your bone builders. Make sure you're exercising. That tells the body to remineralize. One way to look at it is, if you looked at the top 6 cow milk consuming countries on the planet, Denmark, Norway, Sweden, the United States, the United Kingdom, and New Zealand, it identically matches the top 6 countries that have osteoporosis. Something's wrong with this picture. Another way to look at it, the Alaskan Inuit Eskimo is the population on the planet with the highest osteoporosis rates. But look at how much calcium they're really eating. They're eating 2, 3, 4 times the amount of calcium as most Americans. But they're eating it in the presence of a high animal protein diet. Whale blubber, seal, fish. So they're eating a ton of protein, which is kind of canceling out and losing the calcium density in the bones. And paleopathologists, this is where I start in my book, 500 years ago or more, will report the same findings for this population when they dig out the bones from the ice. Their diet has remained the same, their disease rates have remained the same. Another way to look at that, when we take different studies that alternate the amount of calcium with a low protein diet or a high protein diet, what you're looking at in the second column there is a plus sign means the person is remineralizing their bones are becoming more dense. So a plus is a good thing. If you're looking at the other column, the high protein diet, regardless of how much calcium they're eating, if it's a high protein diet, they end up in a minus. A negative number means the calcium is coming out in the urine, taken from bone density, lost in the urine. So regardless of how much calcium you're eating, if it's in the presence of a high protein diet, you're not getting the biggest bang for your buck. What is cow's milk really? I know that, we see wonderful ads and famous people with the cow milk mustache and all of that. My thinking is, why don't you wean? That would be a good thing for an adult too. But really, when we look at it from a scientific standpoint, it's water and butter fat. Casein and whey are the proteins that if you're allergic to milk, you're reacting to the casein in the whey. If you're lactose intolerant, you're not able to digest the sugar lactose, and we'll talk about that in a second. The United States has one of the highest pus counts allowed in a glass of milk. Where do they get the pus? Well, unfortunately, we feed them at least 10 times, we feed them so many hormones so that they will make at least 10 times the amount of milk they need to make to deliver for humans to drink. So any women in the audience who have breastfed, can you imagine if your body was asked to make 10 times the amount of milk you were designed to produce in nature? It's very painful for the cows. They end up with a lot of infections. The infection, of course, brings the pus and the white blood cells. That gets into the milk. We also have iodine contamination in most American milk because they literally paint the udders with iodine to try to control the infection. So there are many things when you just look at a glass of milk scientifically that you probably don't need in a human body. Veterinary antibiotics to fight the infection. Veterinary grade pesticides and hormones. These are all different things that are concentrated in the fat of the animal, delivered into the milk that humans drink. Lactose intolerance. The reason why I put this in quotation marks is because it's a normal state for a human being. It should not be a medical diagnosis. At about age 3 or 4, humans are designed to wean from the mother. When you look worldwide, every culture will wean sometime by age 3 or 4. And naturally speaking, most humans stop making lactase, the enzyme we need to digest lactose. So it's a perfect system as long as you're weaned by age 3 or 4. When you look at different subgroups, Asians, Native Americans, Eskimos, Hispanics, you can see that 50 to 100% of these groups are lactose intolerant. But that's normal. Caucasians, however, seem to be what we call lactase persistent. They're continuing to make lactase. And one of the theories on that is that if you look at Northern European history, we really did associate the high life or the rich life with what the royalty ate. Butters and creams and cream sauces, and it was only the wealthy families that were allowed to have milk from cows to use at the dinner table. So when we emigrated over here, our ancestors really wanted to give us the very best possible life. That's why they came, was to give us a better life. But at the same time that they imported the cow milk, they imported the same disease rates that we see with the royalty in history. So overweight they had to be carried. Gout, arthritis, moodiness, personality disorders. They really had a lot of things that came along with what was meant to be a gift. So I understand the spirit, but the bottom line scientifically was we really did import disease rates. Worldwide, 65% of adults do not consume cow's milk. One more political thing. If you look at cultures that are animal-based in nutrition, they go into puberty at about age 12.5. Unfortunately, very recently now we're seeing African Americans in the South going into puberty at age 8 and age 9. That means they have breasts, periods, and can now reproduce. The problem for me is this is going to make teenage pregnancy skyrocket because at that age they don't understand that a child is forever. You don't put them on a shelf like a doll when you're done playing. That's 24/7. When you look at plant-based dietary cultures, we see that women go into puberty at about age 15. In the China Health study, T. Colin Campbell said that it was closer to age 17. Now, a 15 and a 17-year-old has a little bit better grasp of what long-term means. Not like a 30-year-old having a baby, but certainly much better than an 8 or a 10-year-old having a baby. From a clinical standpoint, the earlier you go into puberty, the higher chance you have of getting breast cancer or having menstrual difficulties later in life. So there's another ethical issue to consider. Where would we get our calcium? Any of the dark greens I talked about? Here we're comparing 100 calories of food in each group. You can see the dark greens are much better than cow's milk, really, for humans. The absorption rate is another factor. The greens are actually absorbed better into the bones than cow's milk for humans. The bottom line here is because we have the companion nutrients intact in the greens. The calcium comes with magnesium, manganese, boron, silicon, phosphorus, zinc. So we have the companion nutrients that your body needs to take that calcium and stick it into your bones. Couple quick comparison slides. If we're looking at 100 grams of food, If broccoli won the category in nutrient, it scored green. If cow's milk won it, it scored red. You can see the only two categories where cow's milk even touched it were vitamin D, which is synthetically added, and calcium. But if you do the math with what is exactly absorbed, we're really only comparing 25 milligrams to 38 milligrams. Not a huge difference when you realize the fiber, phytochemicals, and so on are over here in the broccoli. Comparing it to steak, broccoli wins in every category, so it's the true macho food. Don't let anyone say it's really steak. It's not. Zinc is essentially a tie, but I gave it to steak because even though it's statistically insignificant, I felt bad for the steak. So preventive medicine really does raise the bar. It says we need to get better at educating the public with true science. At our clinic, I'll just touch on this, we also use topical progesterone for osteoporosis when indicated. It stimulates bone growth. It helps balance against excess estrogen. It can also help prevent prostate cancer in men. Okay, general preventive medicine goals. You're looking again, total cholesterol at 150 or approximately 100 plus your age. Blood pressure at 110/70. You've heard 120/80, but we really are looking for 110/70. Making sure you're drinking enough water to urinate 4 to 6 times a day, and having a bowel movement about 2 to 3 times a day. Fiber does two main things. It's kind of like a time release of sugars and nutrients into the body, sort of like a sponge. The second main purpose for the fiber, it provides the bulk for the intestinal muscle to grab and pull the waste along. It's basically about 30 feet long, your intestines, and you need that muscle to have something to grab onto to move the waste along. So that's the purpose of fiber. Again, summarizing, generally speaking, we're eating way too much cholesterol, saturated fat, and trans fats, and so on, and certainly not enough plants. The Physicians Committee for Responsible Medicine makes these recommendations. I like it because it's a diet designed for abundance. It's 3 or more vegetables a day. You could eat 10 servings of vegetables a day. At our clinic, we teach handfuls. About a handful of vegetables would be about a serving. Why? Because over the course of the day, if you're eating a good amount of vegetables and fruits and grains and legumes, you're going to get a nice variety. This is my contact information. If you have any questions at all, please don't hesitate to call me, contact me. If you're doing a paper for school or your children are, I'd be more than happy to help in any way I can. Thank you so much for your attention.
Thank you so much, Dr. Saunders, for that wealth of information.
This program is brought to you by the Vegetarian Society of Hawaii, a nonprofit organization dedicated to sharing with the community the many benefits of a vegetarian diet. Free monthly meetings include vegetarian experts found locally and on the mainland, quick and easy cooking demonstrations, and healthful and delicious food samples. Members enjoy an informative quarterly newsletter, social activities, and discounts at many vegetarian-friendly restaurants and health food stores. For an application, call 944-8344. That's 944-8344. Or visit our website at www.vsh.org. vsh.org.